Overdose Lifeline has been at the forefront of battling the opioid epidemic since 2014. Lindsay Wright joins us now to explain a new effort the group is spearheading.
Thanks, Joe. Overdose Lifeline provides the overdose antidote naloxone to law enforcement agencies across the state and advocates for education and harm reduction. Now the group plans to deliver a new prevention program to students in Indiana, and it's the first time the program has been used in the United States.
The thoughts that you were having, what specifically were you telling yourself about that?
This week, Overdose Lifeline is training to be able to implement a preventative intervention program known as Preventative at schools around the state. The evidence-based program screens adolescents for personality traits, which can indicate higher risk for substance abuse or a mental disorder. Kids are then placed into 5 categories and invited to participate in discussion groups.
That's really part of what we call a stepped care model approach, in which we're trying to provide different sorts of care to different kids with different needs.
Preventative is used in schools throughout Canada, specifically in Montreal, where it was developed. But it's also proven successful in London, the UK, and Australia. Moraine says the program coincides with a critical time in the opioid epidemic in the United States.
And adolescence is that critical period during which addictive behaviors are getting picked up, and to better equip our teens with tools that are appropriate to their personality and that are rigorously based on evidence and research could actually be a tremendous boon when trying to diminish the number of people who end up suffering from addiction.
We're giving kids coping skills, and we could all use a better way of coping with anxiety, no matter who we are and what we're doing.
Phillips says the group will start by piloting Preventative at schools in 7 counties. If it's successful, the goal is to expand to more schools.
So Lindsay, you talked about those kids getting screened. How does that work?
So this is a preventative school-based program. It comes from the University of Montreal, and kids answer around 23 short questions, then they're asked to score themselves, and based on that score, they're placed into one of 5 categories. Some of those include low risk, anxiety sensitive, negative thinking, things like that. Then they're invited to participate in discussion groups based on those personality traits.
So what are some of the goals of the program?
Short term, the goal is to help kids better cope with their personality traits in a positive way. So this isn't focused on drugs, it's not trying to tell kids what not to do, but long term, a goal is to prevent kids from developing a mental health disorder over time. If you teach kids to cope with anxiety, for example, from a young age, you start early, that could potentially reduce the number of substance abusers who suffer from addiction in the future. And in an ideal world, that could relieve some of the burden the healthcare system currently carries with mental health.
So how about here in Indiana? What happens next?
Overdose Lifeline has been training this entire week, the second half of the week, actually working with kids at Hamilton County Juvenile Center as part of the training. So the plan is to pilot Preventative in schools in 7 counties. Those counties include Pulaski, Stark, LaPorte, Howard, Grant, Jennings, and Jackson counties. After implementing it during the 2017-2018 school year, they'll kind of take a step back, look at it, and ultimately determine if it has been successful. And Justin Phillips says the hope is to continue expanding it to schools across Indiana.
All right, thank you very much for covering that story.